It has been 4 months since the first case of COVID-19 was detected in Wuhan, China, and reported to the World Health Organization. Since then, what began as a local outbreak has turned into a worldwide pandemic. There's hardly a person on earth whose life has been unaffected by the spread of the coronavirus. Millions have been infected, almost 200,000 died, billions have had to adjust to a new life of social distancing. Welcome to this Voice of America virtual town hall, Coronavirus, Global Expert Answer Your Questions. And I'm Tatiana Voroshko. While the United States and several countries in Europe have been hardest hit, the virus is growing in Russia, Mexico, Bangladesh, and other countries. In many countries in Africa, Asia, and Latin America, the lack of testing makes it difficult to measure the spread of the pandemic. Social distancing measures that work in some countries may be difficult or simply impossible to implement in others. And at a time when China and some European countries are returning to some semblance of normalcy, a few African countries have recently identified their first cases. To answer your questions about the pandemic, experts from around the world have joined us for a virtual discussion. Please welcome, from India, Dr. Pritima Chanana, Senior Anesthesiologist at the Fortis Memorial Research Institute. From Bangladesh, Mejadi Sabrina Flora, Director of the Institute of Epidemiology, Disease and Research. From Taiwan, Dr. Chan Cheng Chen, Dean of the Taiwan University College of Public Health. And from the United States, Dr. Boris Lushniak, Dean of the School of Public Health, University of Maryland. Thank you, panel, for joining us. And Kate Lister, President of Global Workplace Analytics. Kate will join us later in the broadcast to discuss workplace practices and the coronavirus. Thank you all for being here. And now to discuss the future of our work lives is Kate Lister, President of Global Workplace Analytics, a research and consulting firm that helps employers understand and prepare for the future of work. Kate, welcome. My first question is, what impact will the pandemic have on workplace practices?
It'll have a big impact. We're going to see a lot more people working remotely. We've been doing some surveys around this. A lot more people, about 80% of people are working from home now compared to something less than 10% on a regular basis. And interestingly, they all want to continue to do so. So a lot of people who didn't do it before and now have had the experience want to continue to work at home.
You said 80%, but what percentage do you think would stay?
My own prediction is somewhere around 30% of employees will be working from home multiple days a week when this is all over. I mean, I think there's going to be a period where they want to go back to work. They want to be with people that speak in full sentences rather than their children. But I think after that, there will be a desire to continue working from home. As I say, multiple days a week. It's not an either or. It tends to be something where that halftime is kind of the sweet spot.
But how the pandemic will change the work we do at the office?
This is a trend that really had already begun maybe 5-10 years ago, where offices are being completely reconfigured to be the place of collaboration and home the place of concentration. So I don't know if you've experienced it, but a lot of people find they're more productive when they're at home. There are fewer interruptions, and so they're just able to concentrate better. And companies have realized this already. Large companies have completely changed their office design so that there are places for teams to collaborate and social areas, but not a lot of private space and not a lot of assigned desks. So you come in and you work wherever you need to work to be effective. Now, that's going to change a little bit when we go back also.
And in which industries do you expect the highest growth of telework?
Right now, healthcare, believe it or not, not in terms of the practical part of it, but in terms of the administrative part, is one of the leading industries. Of course, IT, as you would expect,
Right.
Administrative jobs, also call center jobs and customer service jobs. They've been doing remote work for more than a decade, and I think we'll see an increase there as well.
I know it's a huge question, but if you can answer shortly. What would be the benefits of adopting telework on a larger scale?
People, planet, and profit. So for the people, it gives them back their time. They would have otherwise spent commuting an average of 11 days a year that they would have otherwise spent in traffic. They get to save money, and it reduces stress. From the employer's point of view, increased productivity, better attraction and retention. This is something people want to do. Reduced real estate costs and greater sustainability. And from the planet, again, the greater sustainability. We've seen the air clear up in a very short period of time. So we know that reducing commuter travel is important.
What about our lives outside of work? Will we socialize differently?
I think for a time we will. I think anybody that has a compromised immune system is going to want to continue to work virtually. In fact, as companies are planning to bring people back, they're not planning to bring all of them back right away. It's going to be a phased approach. And anybody that has, as I say, an autoimmune problem will be allowed to continue to work at home. Same thing with the social distancing with our friends. I think maybe we'll actually see less of our friends because we're so tired of being on Zoom all day long. I know, speaking for myself, it's very difficult to get up for an evening Zoom call after I've just spent the whole day on it.
Thank you, Kate. Let's hope we will be able to see our coworkers, friends, and neighbors in person soon, and maybe shake a hand or give a hug. This has been the Voice of America Virtual Town Hall, and I'm Tatiana Voroshko. Please stay healthy, safe, and informed. Goodbye.